Now let's get started with today's panel discussion, value sets and strategies for better data quality management. In an era where precision and efficiency are paramount in delivering quality healthcare, mastering data quality and optimizing value sets is more crucial than ever. So what exactly are value sets? What are they used for? And why is data accuracy so important? Today, we'll delve into the unique value set data challenges and hear from two organizations that have been partnering for years to simplify value set implementation and data maintenance, and who continue to evolve their collaboration to keep up with increasingly demanding data needs and unique use cases. First, I want to start by introducing today's panelists from both Intelligent Medical Objects and Cedars-Sinai. We have Mamta Mishra, Group Product Manager at IMO Precision Sets at IMO. Mamta Mishra is a product leader with a focus on driving value with AI solutions in healthcare and life sciences. She's an expert in combining technology, market needs, and innovation to deliver successful offerings and has over 20 years of experience in the industry. In her current role, Mamta is a group product manager at Intelligent Medical Objects, or IMO, responsible for the IMO Precision Sets offering. She previously held healthcare AI-focused product management roles at SAS and Allscripts. Dr. Julie Glasgow, a senior clinical terminologist at IMO. Dr. Glasgow is an experienced clinical terminologist whose background blends computer science, medicine and surgery, and informatics. Her expertise includes the building, maintenance, and evaluation of clinical and administrative groups. She's also involved in tooling design and architecture for the authoring and management of groups. And we have Wendy Sklar-Bleeker, lead analyst at Cedars-Sinai. Wendy has been with Cedars-Sinai for a total of 14 years. She is the lead analyst who supports Cedars-Sinai organization in a variety of ways. For the last 13 years, she's been responsible for all IMO updates and has worked on several IMO early adopter initiatives. Welcome to all of you. We're so glad you're here today. Now, Dr. Glasgow, could you start by telling us a little bit about Intelligent Medical Objects?
Yes, absolutely. Hi, it's great to be with you today. Well, this slide has a few of our overarching facts. We've actually been around for almost 30 years now. We are based in Rosemont, Illinois. And what we do is we create, our base business is to create clinical content for use at the point of care. We have created data that's used by 89% of direct healthcare providers in the United States. As you can see here, 4,500 hospitals, 70% of the US acute care system. And we also have users all over the globe, actually. So the vast majority of clinical providers in the US actually use IMO content. And a lot of times it's without even knowing it, because we're very much an integrated component in the electronic health record. And from the outset, it's been our intent to provide the actual clinical content that providers can use to document patient care, particularly in the problem domain space. We consider that our main focus. So over the decades, we've actually accumulated a very large body of very high quality clinical content. And what we're doing more recently is we're moving into the spaces where we can use that very solid groundwork to build on. So the value sets that we'll be talking about today, they're an example of kind of the expanded usage of that clinical content.
Fantastic. Let's go to Wendy. Wendy, can you tell us a little bit about Cedars-Sinai out in Los Angeles?
Yeah, my name's Wendy, and Cedars-Sinai is a nonprofit academic healthcare organization, and we serve the very diverse city of Los Angeles community and beyond. We are serving 1 million plus each year. We have 40 separate locations, 3 major hospitals, and the rest ambulatory outpatient clinics or surgical centers. We have 4,500 physicians and nurses on staff, and we are working on 1,500 research projects that are currently in motion.
Wonderful. Now, Dr. Glasgow, to give us a foundation and to kind of help us level set, can you tell us what is a value set?
Absolutely. A value set is basically just a set of clinical ideas that are used for some purpose in healthcare. And I usually like to think of problem value sets as kind of the most basic example. So, during the course of care, you see patients, you document your care in the EHR. You have to document it as completely as correctly as possible. And IMO content is used to do that. But there are a lot of uses for that data after the patient has already gone home. For instance, follow-up care. There are a lot of clinical use cases that involve things like, continuity of care. I want to make sure that all of my type 2 diabetes patients are seen back in the clinic on the right schedule. And in order to do that, it's very helpful to have a value set that can go find all those patients that already have a diabetes diagnosis in their chart. Now, in that kind of scenario, you don't want to miss any patients. You don't want anyone to fall through the cracks. So you have to have a very complete and correct value set in order to provide the most high quality level of care. There are also a lot of uses for value sets that are sort of regulatory. A lot of people are familiar with value sets because they're used in things like clinical quality measures. Those value sets are created by the authoritative bodies who run the quality programs. So users don't really have any leeway to alter the value sets. But for a lot of the very clinically focused usage of value sets, it's actually really helpful to be able to tailor the value set to your own need. So things like population health, we want to make sure that all of our patients with hyperlipidemia have that controlled. Are they on the right medication? To look at that through a clinical lens, it's not enough to use the clinical quality measure value set because it won't find a lot of those hyperlipidemia patients. So it's important to be able to tailor the contents of a value set for your particular need so that you're most effective in the use. And one of the projects we're working on with Cedars-Sinai is really ramping up the tooling that will allow entities to tailor the sets to suit their exact needs.
Fantastic. Wendy, do you have anything to add about why value sets are important in the context of healthcare?
Yeah, value sets are very important in the context of healthcare. We use them in a variety of ways, like Dr. Glasgow mentioned, for quality reporting. We use them to track certain data sets of patients or certain clinical groups of patients by using disease-based or problem-based, like she mentioned prior. So there are a lot of usage within the healthcare format to find a place for precision sets or value sets.
Now, Wendy, from a provider organization perspective, how is Cedars-Sinai utilizing value sets?
Right now, we're using them specifically in our oncology space. We're using them for survivorship and staging. So this data is displayed for end users in the way of treatment summaries or oncology history, or again, the cancer staging, certain notifications. The value sets are used in the background, but are very useful to clinicians and end users who are accessing that data.
I see. Now, Mamta, can you tell us a little bit about what makes value set creation and their maintenance so difficult?
Sure. Hi, everyone. I'm Mamta Mishra. So around a year ago, we started doing some analysis. We started interviewing users who are involved in the creation and maintenance of value sets as part of their everyday work. And in these conversations, there were several challenges that came up, but these top three that you see on the screen right now was mentioned across, right? The first one is the complexity or accuracy of the value set, and eventually the accuracy when finding the patient cohort. So when creating or authoring a value set, the customers or the users have to navigate the hierarchy, make a determination, do I add a code with at the parent level with all the child codes, or do I include it? Do I exclude it? Do I cast a wider net? How granular do I go? When they go to, let's say, code system lookup tools or explorer tools and try to find codes by putting in descriptions of code, searching for that, and seeing the results, including that in their value set, they may miss some codes. There is no easy way to navigate and find all the accurate codes that should be part of the value set. So that whole complexity in authoring the value set, that was one of the challenges that stood out. And the second one was, standardization. Several organizations that we talked to had multiple departments within these organizations, and all of them had to create value sets, right? It was required, like Dr. Glasgow and Wendy mentioned just a while ago, it could be required for regulatory reasons, or to identify patient cohorts, or to implement clinical decision support at the point of care. So these different groups did not have a standardized approach to create these value sets. And probably they were not even aware that, they created very similar value sets on a daily basis. So it was repeated work, duplicate value sets across the organization. And again, the definition of the value sets could be different for these various scenarios that they use. So that was another challenge that we came across. And finally, the maintenance aspect of it, right? We have created all these value sets within the organization. And every year, as there are new code system updates that come out, there is manual burden of going to the already created value sets, reviewing them, and keeping them up to date. We've even talked to users where they said that, because of how laborious this whole process was, they chose to recreate a value set if it was 3 months or 4 months old and a new request came in. They just decided not to use the one that they had already created and start one from scratch. So these challenges got us thinking that, okay, seems like a consistent narrative across the users that we spoke to, and probably something needed to be done regarding these. So, okay. IMO also did some surveys to kind of quantify these challenges that we heard and put some numbers around it. And like you can see from this slide, across different code systems, on an average, yearly, there are several updates that happens within each code system. This kind of gives you an idea of I have a repository of value set. However, with every code system update that has been released, it becomes important for me to go revisit each of these value sets and ensure they're still accurate and they are still applicable to the use cases that I use with them.
I see. Now, Wendy, did y'all face any particular challenges with this at Cedars?
Yeah, we've faced a lot of the challenges that Mamta mentioned. Maintenance being a big one, but it's also nice that the value sets offer already a physician or clinically curated library for us to be able to review and use as a starter, or to use entirely instead of creating them from scratch, being able to find clinical content that's already been created that could be ready to fit in certain scenarios.
And I want to open this next question up to all our panelists today. What are some of the consequences of inaccurate value sets or poor data management processes? Wendy, do you want to start with that?
Yeah, sure. Obviously, not being able to capture all of the clinical patient data that we need to by not having accurate value sets, that would be a big consequence of, and time spent on maintenance is another huge consequence, hours and hours remediating value sets from an EHR perspective versus having them already evaluated and updated is a lot simpler process.
Dr. Glasgow, how about you?
Yeah, I'd say on an overarching level, when you're trying to use value sets to evaluate the effectiveness, the clinical effectiveness, the cost effectiveness of your organization, it's the more accurate the data you have, the better, the clearer a picture you'll have of how your organization is doing. But down at the patient level, you can also have very impactful consequences of value sets that are either incomplete or incorrect. You can actually bring about a lapse in the care of a patient who misses follow-up because a value set didn't find them. So there can be a lot of consequences down to the level of an individual patient's health. So that's a huge motivation for a lot of clinicians to want to make sure that the value sets are as complete and correct as possible. And if you have a value set that's finding a lot of false positives, like it returns to you patients that actually you don't want to, have in that value set, that's a big inefficiency. So then you've got a value set that's giving you the burden of having to weed out patients after the results have been given to you. So you don't want that situation either.
I see. Mamta, anything you want to add to that?
I think Wendy and Dr. Glasgow did a great job talking about most of the scenarios. Just to kind of summarize, you heard a lot of applications of value sets like finding patient cohorts, reporting, analytics. If my value set is not accurate, it's going to impact all of those. It may even end up impacting the patient experience at the point of care.
Now, Mamta, can you describe a typical workflow for creating a new value set?
We had the opportunity to interview and understand the whole process of creating a value set across multiple users in this workspace. And in those conversations, we did see that there were some users who had tools available to them to create value set and create a repository and, be able to easily go in there and search for value sets, see if they have one that was already created, use it within their workflow. However, the most common theme that we saw was, let's say a data analyst persona within the organization gets a request for a value set via a request tracking system or maybe an email or however they get the request, right? So once they get the request, they start on working on that value set, creating that value set. They go to code system browsers or lookups to search for specific keywords and find the matching codes. As they find the matching codes, they download it to Excel spreadsheets. Multiple searches result in multiple spreadsheets, and then they consolidate. Once they have that consolidated list, they then go through each of those codes again with a fine-tooth comb to see if those are really applicable or those should be excluded from the value set. Once this first draft is built, this data analyst user persona most of the times collaborates with a clinician user persona to ensure that the accuracy of the value set that they have created is good enough. And if there is any feedback from clinician, they go through the same process again to include that within the value set, multiple iterations of this collaboration, and then the value set is finalized and that Excel spreadsheet is shared with whoever requested for that value set. Now, if you keep in mind how laborious this workflow is, every time I need to update this value set, I need to go through the same process again. Most of the conversations that we had, we found out that to create a value set, it takes anywhere between 3 to 6 weeks because of how laborious and iterative this process is.
I see. So, Wendy, can you tell us about what this process looks like at Cedars-Sinai?
It's a lot of Excel spreadsheet exchange of reviewing diagnosis gathered in the way that she pretty much presented, and reviewing that back with your operational or clinical folks that need to review that data, making modifications, re-reviewing, and going back and forth. So like she mentioned, it's quite laborious to get to a final state.
And Dr. Glasgow, who is typically involved in the creation process? Is it clinicians? Is it analysts? Is it both? Or is it someone else?
Yeah, you know, the way things pan out, it usually is both. I think in a lot of organizations, it is analysts who start out creating value sets, and you know, so they have a lot of the responsibility and you know, frankly, the burden to try to make them as complete and correct as possible. Very often, you're looping in a clinician too, because there will be questions that arise while a value set's being authored that really a clinician is required to answer it, depending on the use to which the value set's going to be made. We also have a lot of organizations where it's actually physicians directly creating value sets, you know, and when they're doing that, they usually are very focused on a very specific either clinical need or maybe a research question. So they usually can just, any questions that arise, and, you know, part of the iterative process is questions arising. So you have in your mind, oh yeah, I want to deal with pneumonia patients. And so I'm going to find all the pneumonia patients. And then as you look at the problem list items that those patients have, questions start to come. It's like, oh, do I want viral pneumonia as well as bacterial pneumonia? What about fungal pneumonia? You know, and the questions get more and more specific as they iterate through those. So at that point, you know, they're answering all the questions as they go from a clinical standpoint because they know what their focus is, but they're still burdened with the tooling processes of having to, you know, express what they want in the value set and then kind of check, is this what I really want? And then they inevitably refine. And that can be a burdensome process. So we're making progress in creating tooling that will ease that whole burden and make it a very streamlined process. You know, I love that little lots of work, no flow, because that really is how it goes. So we're trying to mitigate that. We're trying to add, you know, flow that's intuitive and makes sense, you know, from a clinical standpoint, and is actually helpful in carrying out this really, really complex task of offering a high quality value set.
Fantastic. Mom, anything to add on that?
No, I think Dr. Glasgow did a great job capturing the user personas who are involved in the creation of this process. And like I said earlier, it's an iterative process. There's a lot of back and forth before by the time the value set is ready to be finalized. And that kind of sums up. And like I said earlier, that's why it takes anywhere between 3 to 6 weeks for the whole process to complete and have a final version of the value set that can be used within the workforce.
Yes, you can definitely see how depending on manual spreadsheets is going to slow that process down. Now, Wendy, are there technical considerations that to keep in mind when you're creating, updating, and deploying value sets in an EHR or another system?
Yeah, currently, one of the technical considerations that we have is we try to use concept-based, because concept-based offer a very wide package of diagnosis within a particular concept, and maintenance is much easier versus using a particular other code sets where you're entering one by one by one by one. So we try to start with that. So that's one of the technical considerations that we consider. And then one of the other ones is how much we already have available to us in that particular clinical space, and if we can leverage any of those items or share any of that build, and then what the end use will be, and from the technical perspective to the clinical workflows.
Okay, now Wendy, maybe you can get us started on this. How are IMO and CDERS partnering today on value sets?
Well, today, like I mentioned before, we are using the oncology value sets in our oncology and cancer areas, and we have been for a very long time. Now we're starting to move into some medication protocol using the value sets and some of the refill medication protocol build that we're doing. We're also partnering on working on some other areas within the clinical space where we currently have our very manual, laborious maintenance workflows, where we're going to try to convert those into the value set editor workflows that IMO is offering.
Let's see, Dr. Glasgow, anything to add to that?
Yeah, I kind of want to jump in and talk a little bit more about the oncology value set. that we provide for Cedars-Sinai, because they are pretty compelling because they're a very practical use case. What Cedars is doing is they're finding patients who are cancer patients who are going to need a survivorship plan. Okay, and in order to figure out who those patients are, you really need to know what stage their cancer is. Because if they're stage 1, it's kind of understood that they will survive. They don't need a specific plan. If they're stage 4, it is very insensitive to offer them a survivorship plan. You have to be very careful there. So these value sets, you know, find the patients who have stage 2 or 3. And if you think about it for a little, for anyone who's tried to create a cancer value set can probably immediately guess what I'm about to say. You actually can't create a value set like that using IC10 because IC10 doesn't capture cancer stage. And it's in fact very difficult to create a value set like that using SNOMED, because although SNOMED does capture cancer stage, it's never in the same SNOMED code as the type of cancer. So, you know, and Cedars uses these sets heavily and routinely, and they're of high value to them because they streamline the process of identifying those patients who are going to need survivorship plans. And you literally couldn't create those value sets without the approach of using the most granular clinical data that Cedars has available to them, which is the IMO lexicals that capture the malignant neoplasms with the stage included. So to me, it's a pretty compelling illustration of the difficulties that people who are trying to create value sets encounter, and also here's a solution. This actually works to find these patients.
Absolutely. Amanda, do you have anything to add?
Yeah, actually, I want to take this opportunity to briefly go back to your previous question, which was the technical considerations in this process, and then tie into how that comes into play in how we are partnering with Cedars today, right? So when we started envisioning this product, and I called out the 3 challenges earlier, one of the things that we saw was the need for a repository or a one place stop for all the value sets need, where you can access the value sets that you have generated or authored custom to your organization, and then some industry standard value sets which may be available within the VSAC website or NCQA website. And then IMO curates value sets and keeps them up to date with every core system release. So all these already available value sets and the custom ones that customer creates for their organization, a one-stop repository. Think of a tooling which will allow them to access these value sets in one place, search for a specific value set, and if it meets their criteria, just use that value set as is within their workflow, or create a copy of it and a variation to add or remove codes, and further customize it for a specific use case they may be working on. So a repository like that was one tooling technical consideration that we worked on when we were envisioning a solution for this challenge. And then, okay, I have my value sets, and then I have different EHRs and different downstream systems. How do I make it easy for me to download the value sets that I have just authored and readily available within my downstream system to, quickly for a quick turnaround time, and to identify patient cohort or implement a clinical decision support, whatever the use case may be? How do I make it available within my downstream system? So when you think of that interoperability aspect, it could be if I'm working with a specific EHR, can I configure my download of format of the value set to be applicable to the EHR? Or can I think of APIs? Can I make an API call from the downstream system and request the details for a specific value set, which will allow me to, implement real-time checks or real-time alerts on the EHR system or any other downstream system? Or maybe if I have data warehouse or a database that I'm working on, can I build connectors to ensure whatever value sets that I've created within this new tool, and as I update it, those latest versions are available within the downstream system quickly and immediately for me to continue working without losing any time there. So those were some of the technical considerations that we kept in mind. And we are designing a tool, which is what we are partnering with Cedars right now to kind of test. We work on a bi-weekly basis to present this product to Cedars, and they provide us valuable feedback, which ensures that any functionality that we are building into the tool is applicable to our customer base. The other aspect that we also considered is, I mentioned to you earlier, as of today, customers may have already created several value sets. It could be in their some kind of a tooling that they're using to maintain these value sets. It could be a relational database or Excel spreadsheets. How do we make it easy for them to consolidate all of those value sets and import it into this new tool so that they can access it all in one place and have a standardized way or process for creating and governance around maintaining these value sets?
Fantastic. Absolutely. Sounds like a great way to move past the spreadsheets and get a little more efficient. Wendy, what does Cedars hope to gain from an all-in-one value set management solution? And are there any specific KPIs or other metrics that you might use to measure your success?
Obviously, the oncology space is something that we'll continue to do and expand out to other clinical needs that we're looking for solutions for out of our normal process. The biggest measurement that we're looking for is the time and maintenance that we're spending on that whole spreadsheet process, because not only is the creation process daunting to be going back and forth with spreadsheets, but the maintenance process is also really cumbersome. And with IMO solution, with the value set editor and the precision sets, we're able to have these things maintained with each of our IMO loads, which is very important to us to reduce unnecessary time that we can be working on other things than this constant maintenance. So that and partnership on other creation of value sets that we need for either our meaningful use space or some of the other highly prioritized clinical spaces is the things that we're looking forward to working on in the future.
I see. Now, Dr. Glasgow, Mamta, how can other organizations follow in these footsteps? Like, do you have any kind of best practices you can recommend in terms of reassessing value sets and your data quality strategy?
Well, I feel like organizations that do try to author and use value sets, I feel like this will resonate with them. And our aim is really to try to ease a lot of the pain points that organizations encounter as they use, these very important, powerful tools. Medical data, it never stands still. So your groups are always going to need to be updated. That maintenance, it tends to be episodic. It's often not even on a regular pattern. Some data is updated on a regular pattern, but a lot isn't. So that actually, gives you a lot of logistical issues when you try to maintain internally, just using your own tools. So we've been intent on trying to build solutions that will actually ease that burden. A lot of it is the standard value set updates. IMO actually takes care of ourselves. We have the processes, it's all on, our part of our routine operations that we are constantly maintaining value sets. So, this is part of our whole goal all along has been to take terminology burdens off of the care organizations and, have them lean on us more to manage and maintain and create those very, atomic clinical concepts. So if this information we're sharing today sounds good to anyone who's watching, they should feel free to contact us because, we really do feel like we have have solutions that can carry forward and are actual, effective, cost-effective, time-effective solutions.
It certainly seems like a way to help identify, some of the redundancies in the process. Martha, do you have anything to add on that?
Yeah, so some of the challenges that we heard in our conversations with the customers is what we used as the guiding principles to define the feature functionality for the product that we are currently building. For instance, like I said, a one-stop shop for all the value sets, which everyone within the organization have access to the same repository. And when they click into a value set, it's the same view everyone sees. So they're looking at the same thing when collaborating and discussing a value set. And the second one, like I said, while authoring the value set, make the process easier, right? Take away a little bit of the burden from the user who's authoring a value set to give them the hierarchical view for the code system and take away the take away the challenge to ensure that every code that is applicable has it been considered and included or not, because now they can look at the hierarchy and say, I want to include this parent with all the child codes maybe. And the third thing is, while I'm doing this, I mentioned to you earlier, there's a lot of collaboration happening. Sometimes it is via the email. Since I have this common tool, which is accessible to all the users within the organization, can I leverage that to make that collaboration happen? While I'm authoring a value set, can I tag a clinical user and say, hey, I'm working on this value set. I have a question about this specific area. Can you resolve that for me? The response is right there available for the user. And it's also tracked and documented in the process of creating that value set. And then over a period of time, I'm going to be editing this value set over and over again. So allowing the users to capture some comments to say, why were some codes added? Why were some codes removed? And creating versions of those value set over a period of time. And then ability to compare the versions to see in 2022, how did this value set look versus what was modified in 2023? Do I need to add some codes back or remove some codes to make it more accurate? It's an entire package, both the authorship as well as governance, and then to add to it the maintenance, right? When a code system update has happened, the tool will notify the user to say, out of your 100 custom value sets that you may have today, how many have been impacted? Give them an easy way to access those impacted value sets, look at the impacts and consolidate them, create a new version, and hopefully save time in doing all of this and make it a quick turnaround process to create or maintain a value set, keep it up to date.
Terrific. Well, Mamta, Dr. Glasgow, Wendy, thank you all so much for a wonderful presentation. And I want to remind everyone that you can continue to submit questions in the Q&A window to the right of the media player. It looks like we have some questions already. Here's our first one. Okay. A few of you have mentioned pre-packaged value sets from IMO. Can you explain a little bit more about what these are and what makes them unique? Dr. Glasgow, do you want to take that one? Mamta?
Yeah, absolutely. I would say we do have a pretty sweeping set of kind of out-of-the-box offerings of very clinically focused value sets. Dozens and dozens of them, really. What we've found over time is that organizations value the ability to tailor value sets so that they can be used for the very, very specific use case they have in mind. For instance, if you're using oncology, well, this slide actually, this is showing just our oncology-focused value sets. And this is an area we've worked with pretty extensively with Cedars-Sinai, so it's appropriate to our conversation here. But these are very focused on oncology, the survivorship care plan that we've talked about. We also have clinical staging that helps the workflow in which the stage of the cancer is documented, and also specific types of cancer, finding the patient cohorts that have those. But this is just the tip of the iceberg, really. We have value sets that cover, acute, chronic, infectious, cardiac, respiratory, just, so many clinical areas. And now with this suite of tooling, we also give users the power to tailor those for their specific needs. For instance, our diabetes value set, our out of the box doesn't include gestational, right? So if that's fine for you, then maybe you can use that one. But what if you do want to also find gestational diabetes patients? Well, then, you'd need to do something to tailor that. And so we're moving into this new world where we empower you to do that.
Terrific. And here's another question, Dr. Glasgow. You want to take this one? What trends do you anticipate in the value set space?
Well, there's always this sort of march upward to try to increase the ability to, create a complete correct value set. But of course, on everyone's mind is, AI and big data models and what have you. So IMO is also pursuing and exploring all of those more recent developments and innovations in data management in general. I guess, to address this slide that we're looking at right now, it's been a constant struggle to try to increase the quality that organizations get out of the data they've already recorded. And a lot of this is in sort of the reimbursement space is a really basic one. And so we actually have value sets that help with just the mechanics of coding your chart for successful reimbursement, because we have found in speaking with our customers that, I think that, COVID disrupted a lot of operations of healthcare organizations. Right now, folks are kind of getting back up to speed. And what we're finding is that they feel the need to be very intent on their reimbursements, because that's an area that they had to kind of pay less attention to as they're struggling to care for COVID patients. Well, now they're trying to really tune up those operations. So that's a very, it's not really an innovative way that healthcare data is used, but it's a really important one to all of the organizations. And, so that's certainly an area that we're emphasizing also.
Hey, Mom, anything to add on that?
Yeah, I just want to call out, in addition to what Dr. Glasgow said, the numbers that you see on this slide, it was a market research survey that IMO had conducted earlier this year. And you can see, we kind of surveyed our respondents and said, okay, how do you, what is the biggest challenge that you see with data today? And like you can see on the slide, 45% said that data issues are a major threat. They think are a major threat to their organization. And then 63% was open to invest in data enablement software. And then the staggering 90% said that they have incurred some revenue loss due to poor data use. This was a survey across several users that we received. And from this, you can clearly see that there is a resource or time implications as well as financial implications to the process. With this new tool, which allows you to manage author and maintain value sets, we want to try and address some of these concerns.
Terrific. And looks like we have time for one more question. What are you hearing from organizations looking to get more value from their data? Mamta, do you want to take that one?
Sure. We have mentioned the IMO Precision Sets product, which also has a value set authorship tool as part of it. And we've been working with some partners on, how to envision this product, how to design it, what feature functionality will be useful. And across these partners, what I'm hearing is validation that the challenges that we identified are applicable to all these organizations, and they would like to make their value set curation and authorship workflows more efficient, right? That is coming across all our interactions with our partners.
Yeah, there are clinical cohorts that are being done for purely clinical reasons. There's clinical data that needs to be analyzed at an organizational level to keep your finger on the pulse of how effective and efficient your organization is. There are the regulatory reporting requirements. And it's just a whole array of different concerns that organizations have. And, a lot of organizations feel like, we have all this data, so much clinical data, let's try to make really productive use of it. We should be able to do a lot of analysis that'll help us identify problem areas. It'll help us identify things we're doing well. It'll help us identify, paths we might take to improve operations, improved efficiency, and improved patient care. And so that's where our aim is, to be a part of that whole endeavor and help them succeed to do that.
Wonderful. Well, at this time, we do have to wrap up. Thank you again, Dr. Glasgow, Mamta, and Wendy, for all of your insights.
Thank you very much, Marianne, for your help.
Thank you.